Go to giftoflife.org and get a free kit sent to your home, or find a donor drive in your area so that you can swab a cheek and save a life. It's only a minute of your time, but it can give someone else the rest of their life.
And welcome back once again to more right here on Herbally Yours on the Voice of Nassau Community College 90.3 WHPC. And today we are speaking to physician Jennifer Jacobs about the dangers of overmedication and her new book, Do You Really Need That Pill? How to Avoid Side Effects, Interactions, and Other Dangers of Overmedication. So thank you so much for being our guest today, Dr. Jacobs. Now, what you said about almost everybody over 60 or 65 being on 5 medications at least. I do want to tell you, I'm way over and I'm not on any, but more importantly, my parents who are in their 90s are also not on any medication. And some of the studies that have very much supported the fact that especially people 80 and above who are not on medications are actually much more likely to still be having a vibrant, active life.
Yes, exactly. And I run into people all the time who say, my parents are in their 90s and they don't take any drugs. It's true. There have been studies. There was one on dementia, cognitive ability, and it showed that people who were not taking blood pressure medicine, for example, and their blood pressure was moderately high, maybe 130 to 150, the systolic, they actually had fewer cognitive problems than people who were taking blood pressure medications to bring their blood pressure down below 120 systolic. So there's a lot of research out there. The problem is that people don't have access to it. It's buried in medical journals. And I was really surprised at everything I found once I started searching through the internet and finding research studies to validate some of these things.
That's so true, and I have done that recently as well. There was a pretty powerful one, even in 2014, in the journal Gerontology, looking at a large group of 85 plus, and the fact that there was an increased morbidity as the cholesterol level was lower.
Yes. Cholesterol, that's a big one. I think that if it were up to the drug companies, everybody over age 65 would be taking a statin drug. And yet, as you say, 25% of the cholesterol in your body is in your brain. So if you cut down on cholesterol, it makes sense that the cholesterol in your brain would also be affected. And cholesterol is necessary for neurotransmitters, the chemicals in your brain that transmit information from one cell to another. So, yes, I think that's a very important issue.
Now, the problem, of course, is most of my clients that I might speak to will tell me, well, my doctor said I have to take this, which I'm sure they are. So how do people discuss with the doctor the fact that they're not interested in taking so much medication? Also, of course, what you want to do is change your lifestyle and bring down those risk factors through exercise and through diet. And then you can discuss with your doctor, well, now my HDL, my good cholesterol is way high. I can test my ApoA to ApoB ratio to see what kind of LDL particles I have and take an intelligent course of action.
Yes, you're absolutely right. It's very difficult for people to confront their doctors. I mean, I know it's even hard for me, and I'm a doctor, but once you get into that room and you sit there for a while and, maybe you have on a flimsy gown and then this authoritative figure walks in. I mean, it's really hard to advocate for yourself, but you have to realize it's your body, it's your health, it's your life, and, actually you're paying this person, or your insurance company is, to be of service to you. So anyway, but I do tell people to come prepared, to research the drugs they're on, to look up the side effects. There's actually a drug site, a website, drugs.com, that has an interactive feature where people can enter the names of each and every drug they're taking, and then the website will tell them which drugs have a chance of interacting poorly with each other. So I think if people are proactive and become prepared to speak to the doctors actually might be relieved. I think a lot of doctors prescribe drugs because they think people expect them, and most people do. And so if they do come upon a patient who is educated, who has done research into their own situation, they might react more favorably than people expect. And oftentimes they will say, well, let's try taking you off this, or let's cut it down a little bit and see what happens. So we need to give doctors more of a chance, I think, to respond positively.
Now, just for another view, when you're taking vitamins and herbs and nutritional supplements, there's also a very real chance, and lots of good websites to look this up on as well, about supplement drug interactions.
Absolutely. And I do have some information in my book about those kinds of interactions. Some herbs, for example, St. John's wort, which is often used for depression, does interact poorly with a lot of different drugs. So people have to be careful. And also over-the-counter drugs. People sometimes think, oh, I'm going to take an aspirin or Tylenol or ibuprofen. Well, those drugs are fairly harmless if you take them in low dosage. But there are nearly 100,000 hospitalizations each year from the misuse of aspirin and ibuprofen, which are non-steroidal anti-inflammatory drugs, and 16,000 deaths each year from overdosing these simple over-the-counter pain relievers. So just because it's not a prescription drug does not mean it's harmless.
That's true. And boy, oh boy, those are big numbers. So when they talk about which are potentially higher in terms of possible harmful effects, herbs and supplements versus pharmaceutical drugs, be they prescription or over the counter, herbs and supplements win hands down in terms of their safety record, even though they're not 100% safe all the time for everyone.
Well, nothing is, I mean, everything that helps can also harm. And so people need to be careful about everything that they take into their body. And I agree with you. Exercise, diet, keeping your weight under control, and not smoking. Those 4 factors have been found to prevent, if you don't do those things, if you do them the right way, 80% of heart disease can be prevented by leading a healthy lifestyle. And yet we don't see doctors, we don't see ads, certainly ads on the television telling us to have a healthy lifestyle to drop our cholesterol.
So true. And I want to remind you that you're listening to Herbally Yours on the Voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse, and my guest today is Dr. Jennifer Jacobs, MD. We were talking about her book, Do You Really Need That Pill? And it's so great that you're bringing this information out to the public, because I think people do need to be aware of the side effects. And of course, there are times when drugs truly are necessary, but it seems like there's such an overuse, especially for health issues that are not that dangerous. Like if you have a cholesterol of 220 and they put you on statin drugs, there's much more danger to the statin drugs than to that kind of level of cholesterol, especially depending on what your ratio is.
Absolutely. And when I was in medical school, 220 was considered normal cholesterol. I think anything under 240, they said, was okay. But over the years, and because of certain advisory groups, the level of cholesterol that is considered acceptable has gotten lower and lower. And as you probably know, Ellen, the members of the advisory panels that make these decisions about what your cholesterol should be, what your blood pressure should be, what your blood sugar should be, are all people, consultants to many of the pharmaceutical companies that make the drugs to treat these illnesses. There was one panel around cholesterol level where 6 out of the 9 panel members received research grants, consulting fees from at least 3 of the manufacturers of statin drugs. So doctors are pressured to follow these clinical guidelines. In fact, they're often even graded on them now as far as how they are able to keep their patients' blood sugar, cholesterol, blood pressure below certain levels. Some places they can get bonuses, or they can get their paycheck docked if they don't keep their patients to these guidelines.
What? I never heard that one. So the doctors could get their paychecks docked by whom if they don't keep their patients to those guidelines?
Well, oftentimes doctors now are not, their own boss. They are employed by hospital systems or by large groups, and there's a movement towards evaluating doctors based upon how well they keep their patients in check in terms of specific numbers. They're not looking at patients as people, as individuals, but, basically using statistics and different guidelines to keep everyone within certain parameters.
That's just absolutely shocking when you think about it, because it's not based on health, which is what you got into medicine for, and so many doctors did, I must say. But then when it becomes the business of selling pharmaceuticals as the end point, rather than your overall patient's health and wellness as your end point, that is definitely a problem.
Right, yes. And so I'm hoping that my book will at least start the conversation that we need to start to address this problem.
Well, Dr. Jacobs, I want to thank you so much for being our guest. Where can people find out more about you or your book? Do you really need that pill?
Well, the book is available in many bookstores. It's available online. I do have a website, www.jenniferjacobsmd.com. And I just hope people will look into this issue and read my book and start becoming more proactive about their health.
Well, thank you so much for being our guest today, and thank you, listeners, for tuning in to Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.